Does your child have ADHD or you suspect that they might? Find out how to give them some support on this episode of Inspire Iredell.
Welcome to Inspire Iredell. I'm Megan.
I'm Anna.
And today we're excited to have, you were going to say your name yourself. And this is?
I'm Dr. Michael Tjahjadi. Nice to meet you.
Dr. Tjahjadi is a pediatrician at Iredell Pediatrics. He has over a decade of experience. He is passionate about strengthening family relationships and is a musician and a dad to a 1-year-old, a son. Tell us, what's your favorite part about being a dad so far?
Oh, yeah. He's really cute. He's a lot.
He's so cute, though.
His personality is definitely showing up, but there's something special about being a parent. And parents that are listening, you guys know what I'm talking about. Yeah. It's just hard to explain. Something in your chest that you're just like, I love him. Even when he's like troublesome, sometimes you're like, I'm tired. But the moment he goes to bed, you're like, I want to be with you again.
Yes.
Yes.
Yeah. So it's interesting how that parent-child relationship evolves. Like I have a child about to go into high school, but I still have those moments. Like recently she's been like, do you want to play a game? And I'm like, and one day I was really tired and I was thinking like, actually, no, I really don't. But then this little voice in my head was like, she's not going to ask you to do that for long. So I was like, okay, let me do it. And then it was, like made her night when I was like, hey, let's go play a game. But anyway.
Yeah, especially how it relates to parenting, because we'll talk about some of that today as well. And when you mention things change, even from a baby to a 1-year-old, there's a lot of change. And we're going to talk about things related to how they're doing at home, at school. And things change even in those years, early childhood, preteen, teenager. And so some of these parents that maybe you're listening, you're thinking, that's exactly me. Like there's a lot of change that's been happening and maybe I'm a little confused or not knowing how to help my child. And so that's why I'm really looking forward to this conversation today.
Yeah, we are excited about this. So
we're kind of hitting hard on ADHD today. So, and we'll kind of go into more, of the support that you can give your child a little bit later in the episode. But first, what is ADHD?
Yes, that's an excellent place to start because we need to make sure we have an understanding of what this term means.
Right.
Yes. So I'm going to answer this in 2 parts.
Okay.
So the first one, I'm going to talk about the medical definition of ADHD.
Yeah.
And then the second part, I'm going to lean more into the heart of it and what I share with parents.
Okay.
Just my personal thoughts. So let's start with the medical definition. So with ADHD, it is what's called a clinical diagnosis. So that means there's no test, there's no brain scan, there's no swab that's going to test for it. It's a clinical diagnosis, which means based on the story and the level of functioning, that's where we can make the diagnosis of ADHD.
So a physician makes the diagnosis based on those factors.
That's correct.
Got it.
It does not necessarily have to be a physician. So sometimes a trained psychologist could do that as well.
Okay, yeah.
But the physician is usually the one that can help manage or treat or in combination with some specialists.
Okay.
So yes, that's correct. And in general, you look for 2 things, one of 2 things. One is hyperactivity, and then the second is inattention or inability to focus, or a combination of both. Now, the important thing to know with these 2 things is, as human beings, don't we all sometimes lose focus?
Yes.
Don't we all sometimes, or
Yes.
some people just a little more hyperactive than others, and that is true. And so therefore, it's not just having one of these 2 things or both, it's how is the child doing in relation to what is expected for their peers at their age.
Okay.
And so therefore,
okay.
does it cause a level of impairment? And impairment is severe functioning at home, school, and you have to see it in multiple different environments. So it may impact one environment more than the other, but when you see it in different environments, we know that this is more likely ADHD rather than just one environment. So for example, let's say they have a lot of different classes, they're wonderful at home, they're doing great in all their classes, but in one class, they're really struggling in. It may not be ADHD, because there's other things that could be going on.
They may not enjoy the subject. The
Right.
teacher may not be explaining it in a way they understand. They might,
Exactly.
maybe they're being bullied in that class or something like that.
Yeah, there could be
Exactly.
a lot of different
Yeah.
things.
Exactly. So that's why to make an accurate diagnosis, you need to have a well-rounded picture of what's going on at home, what's going on at school, and also, depending on their age, what has happened before then, leading up to now, to have a full picture. And some kids, it's very straightforward that after the evaluation, yes, they do qualify for ADHD. Some they have multiple things, and that can be present. It may not just be necessarily one thing.
So we were talking a little bit before. It used to be that there was ADHD and ADD, but now they are one and the same. They've just changed the diagnosis, I guess. So
You can say they changed the label.
they changed the label. So it's the same thing. So you mentioned hyperactivity. So when I was younger, so I've been diagnosed with, it was ADD at the time, but I guess now it's ADHD. But when I remember when I was younger, and I was not diagnosed until an adult, I was an adult. But I remember hearing about kids that had ADHD and this hyperactivity. And I was thinking like, they don't seem hyper to me. Like I remember thinking hyperactivity must mean they're like bouncing off the walls and going crazy, right? But that's not necessarily what that means, right? I've come to understand that maybe it's more of a hyperactivity of the brain. Like your brain is, that's how my brain works at least.
Yeah.
That's a good question. So it can be a little bit of both.
Okay.
Because the brain controls the body, right?
Oh, yeah.
So therefore, that hyperactivity, if it's not causing impairment, one could argue, is the diagnosis of ADHD helpful or not? So as I answer this question, let me get on to the other point I wanted to make is what I share with families, and I think this is very helpful as well.
Okay.
I like to tell them this. The label does not define who you are.
Yes.
In essence, it's almost like whether your child has ADHD or the old definition of ADD, at the end of the day, it doesn't matter. That doesn't define your child. But a label can help others to meet you where you are.
Yes. Amen.
Wow.
Like, yes. Okay, say that again.
Yeah, say it one more time.
The label does not define who you are, but a label can help others to meet you where you are. That is, label is not for identity. And this is where some parents make the mistake of thinking, I'm scared to get a diagnosis because I don't want my child to live with a label or feel like they are less than or somehow that there's something wrong with them. And that's where I say, this label doesn't change who they are. They're still the same child.
Right.
But also don't be afraid of the label if it helps understanding, communication. Yes. Now I can know how to get the proper support they need. That's when the label can be powerful, and that's why it can help others to meet you where you are. So in that sense, yes, the label has changed from previously ADD. Now they just say ADHD, either predominantly inattentive type or predominantly hyperactive type or both. Mm-hmm. So the way I like to see it is that these symptoms, if you want to use a medical word or medical label, or we can just call it presentations of how much hyperactivity we have, how much ability to focus we have. It's on a spectrum, but once it crosses the line of it's meeting impairment, it's causing impairment and causing a problem, school, home, multiple environments, that's when we say, you know what? I think the label of ADHD is helpful here because that can direct the next steps. Not everyone needs medication, but for many that helps. Some, maybe they need help with scaffolding at home, school, structured supports. So there's a lot of things that we could do, sometimes medicine, but definitely non-medicine strategies to help understand what they're going through, how their brain is working, and also how to help them go forward.
So you go ahead.
Oh, I was just going to say that you mentioning that meeting people where they are and the communication side of things. So I've been married for almost 19 years. I only got a diagnosis probably was in 2018. So, we've been married a good chunk of time before then. And oftentimes my husband would be frustrated because he'd be trying to tell me something and my brain, it's like there's 5 trains going in different directions all the time, right? And when I got that diagnosis, he had this kind of epiphany-like moment of, that explains so much. And he suddenly, it made it feel much less personal to him. Like there were times in our communication perhaps where he felt like I just didn't care about what he was saying. And that was not the case at all. And he's a very understanding person and a great communicator, excellent communicator. And so when I did not communicate back with him the same way he communicated with me, it was really frustrating for him, naturally so, right? I would probably have felt the same way if the roles were reversed. So getting that diagnosis helped us be able to have conversations about what we needed to do so that when there was something important he needed to tell me, he made sure I was in the correct kind of headspace to be able to give him more focused attention on it. So, and it's made a huge difference. We didn't have problems in our relationship, but there was tension here or there around some of those things. And I could not understand why, because to me, I'm thinking like, I'm not doing anything wrong, right? He can't understand, pre-diagnosis, why I wasn't giving him the same amount of attention that he was giving me when we were like with listening. And there we are with a diagnosis, and suddenly things just click into place. So anyway,
Gotcha.
my own little personal story there.
Yeah.
Thank you. Yeah, thank you for sharing that, because I think for those listening out here, this is where could become important, not just for your child with ADHD or suspected ADHD, but potentially relationships in general, because you just articulated something. When we understand each other, when you understand as a parent your child's brain, how they function, you know how to better communicate and better respond to them. And that communication, that response, is what changes everything.
Yeah.
So as we talk today, I want to give parents an empowering principle that can help to know, why is my teen or child stuck in whatever they're doing? That frustration, like, are they not listening to me? Do they not just want to do what I say? Right? And that's in a similar manner what you experience, and that's what you're sharing. Once you have the understanding, then you can help to communicate.
Right.
Do you mind if I share like what I tell parents and like how I help them think about this?
Yeah.
So one of the things I like to do is how can we take the complexities of science, human behavior, and simplify it in a way that helps us understand and helps us communicate. So I like to think about it this way. Let's start with an example. Think of a child or a teen, and let's say something at home that parents would commonly struggle with, whether it's personal, whether it's just made up. And now it's August.
Cleaning their
so-
room.
Okay, cleaning their room. Okay, that's good. So usually I hear chores or homework. Those are one of the two big things, right? So let's start with cleaning their room. Let's say you ask your child to clean their room. Nothing happens. And then so you ask them again, like, hey, don't forget to clean your room. Okay. But we know how it goes, right? Nothing happens. Hey, this is the third time I'm reminding you, don't forget to. And it just keeps escalating, right? Does it sound familiar?
Yeah, actually, yeah, even
Yes.
with my 5-year-old.
Okay, okay, yes.
I hate to tell you, it doesn't stop at 14.
So whether they're 5, whether they're 14, whether they're 95,
Okay.
here are 3 questions that you can ask yourself. Do they know how to do it?
Okay.
Do they feel able to do it right now? And do they want to do it?
Okay.
How, feel, and want. And here's why this question is important, because a lot of the times the responses we say and how we communicate doesn't actually address what's keeping them stuck in a moment. So let's consider the how question. On the surface, let's just start there. Okay, do they know how to do it? Do they know how to clean their room? Okay, let's just start there. What does that imply? Like, imagine you're putting yourself in your child, in your teen, like think through what that actually means.
Yeah.
Where to start?
Yeah, what do the tasks include, right?
Yeah.
Like, because I know with my daughter, sometimes I'll say, no, you need to clean your room how I like it clean. Because she's learned, like, she'll be like, it is clean. And I'll be like, no, it isn't. Doesn't meet my standards. Like, so.
Exactly.
Yeah.
Or if so we have a playroom, and if I tell my daughter to clean her playroom, because it explodes all the time because it's
A
toys
playroom.
everywhere.
Yeah.
If I just tell her to go in there, she's 5 and she can tidy up. That's age appropriate to tidy up, but I'll have to say, let's start with your Barbies. Take your
Yeah,
Barbies,
be
and
specific.
once all of your Barbies are put away, come get me. Great, that's done. All right, let's take all of your stuffies and put them on the couch. All right, once all that's done, then we'll go to the next step. And that seems to help a little bit. So
yes, you both have articulated something that's very powerful. The first is clean your room is not just one step.
yeah.
We say clean your room as if it's just one thing to do, but it's
A
10,
list.
it's 10 steps, 20 steps.
Yeah.
Where do I start? And we've only delved into the surface of, do you know how to do it, how to clean the room? Where does ADHD come in? Because even without ADHD, you could say that, oh yeah, this applies to any human being. You could use these 3 questions, how, feel, and want. But how does this specifically tie into ADHD? Because one way to view ADHD is, from the medical sense, a neurodevelopmental delay. That is, if somebody is 10 years old, their executive functioning may be that of a 7-year-old. And so executive function is a fancy word that basically helps us get started and follow through. And part of that executive function involves planning, prioritizing, time management. So these are the deeper how-related questions. So not just do they know the 20 steps of how to clean their room, do they also know what it means to be done? Do they know how to stop a high dopamine activity and start a lower dopamine activity, like cleaning the room? Do they know how to time manage, because they have to know approximately from beginning to end how to manage the time? Maybe they're given more freedom in, don't forget to clean your room today, but today is this wide open, nebulous, when is that going to happen? Maybe they think I'll just do it later. So that's the prioritizing part. And this potentially could lead to the next thing. Do they feel able to do it right now? Many times, not knowing how leads to not feeling able to do it in the moment.
Makes sense.
So think of this, 20 steps. That's a lot. Like, where do I start? If I do this or that, I don't know when it's done. Their brain gets overwhelmed. And when the emotional part of the brain takes over, if you've ever been stressed, is it harder to think? Is it harder to process? Absolutely. So same in human beings, regardless of the label of ADHD. So that's why I want to ensure that it's not just, here's strategies for ADHD, here's strategies for other human beings. No, it's all humans. But ADHD, the label, helps to explain. And not feeling able makes it harder to get started and follow through, because you need the thinking part of the brain to solve how-related problems.
Yeah.
And when you don't have the thinking part of the brain to solve how-related problems, guess what? That becomes more overwhelming. And because of more overwhelming, what happens? You don't feel able to do it in that moment. When you don't feel able, guess what?
You don't want
more
to
overwhelming.
do it.
Exactly. That can cycle from not knowing how, not feeling able, I still can't figure out how, I still can't feel able. Maybe I just don't want to do it because this is overwhelming. Or maybe internally, I do want to do it, I just don't know how, or I don't feel able to. And we'll get to the want, but the feel is, in essence, pressing the snooze button on the activity.
Yeah.
Because if it feels overwhelming right now, I don't know how to start from step 1 to step 20 or even know what the steps are. Maybe if I put it off, then later I'll feel like it. If any of us have had those moments where I'm getting up in the morning, I know what to do. I just can't get my brain and body to do it. I'm just going to hit the snooze button. Or even how many times we are in bed, we know we should go to bed. We know what to do. We know that we should.
Or you're reading until midnight.
Yes, exactly.
I don't know what you're talking about.
Exactly. Yeah, I've never done this. Never, yeah. But how many times are we doom scrolling on our phone?
Yes, doom scrolling.
And we know what to do. In fact, we know sort of how to do it. Turn off, put the phone down, close eyes, done.
Yeah.
What are we doing? We have to go from a higher dopamine activity to lower dopamine activity.
Wow, yeah.
In that moment, we kind of sort of know how to do it. I just put the steps, but how do I get my brain and body to do that? If I don't feel able, then I'm just snoozing. I'm hitting the postponement button on what I actually need to do. So could it be when your child is stuck, when you give a reminder, when you give them the 7th reminder and then still things are not done, ask yourself, maybe just what if? What if they're not being willfully disobedient? What if they're not being defiant on purpose? What if they're actually stuck? It's because that's a how-related problem, potentially, or a feel-related problem. And how you respond depends on what the barrier is in that moment. So when you mentioned that they were stuck on clean your room, and you said, let me narrow it down. So you said, let's start with the Barbie dolls. Then let's move on to cleaning the next part of the room. Guess what? Your child was able to start and follow through. So what did you do in that moment? You were addressing the how barrier rather than just giving reminder number 7, hey, you're not doing it. You're going to get punished if you don't do it. You're helping guide them in what they need. And so therefore, as a parent, you may need to know what kind of structure do they need at this moment to solve this how-related problem. If something very open-ended is too much, like clean your room, narrow it down and give them something that is more structured, like, do you want to start with the Barbie dolls or do you want to start with the blocks?
Yeah, I mean, choices are also great for kids.
Yes, exactly.
Yeah, so.
You're giving them structure.
Yeah.
You're giving them a say in how they do it, and that is scaffolding to help them teach it. So I like to think about it like this. Keep it open when okay. Keep it simple when stuck.
Open, okay, simple stuff. Okay.
Yep.
Yeah, I'm writing it down so many
yes.
things. So what if you're in a school situation and maybe your child, maybe they are younger, or maybe, they just don't really fully grasp that they may have some of this, some ADHD symptoms. And maybe as a parent, you know how to deal with it at home, you know how to support your child, but maybe the teacher really just doesn't have a good grasp on it. And so they're having a hard time learning. What do you do in that situation?
That's a great question, because I'm a firm believer that parents are one of the most are powerfully positioned to help change in home. But how does that apply to other environments like the school? So of course it starts with the home. That's one thing that has to happen. But what do you do afterwards? This is where knowing what value labels give can actually help. Because some teachers are excellent at knowing what to look for regarding ADHD and all the other labels that we have out there. And some teachers may struggle. And that's nothing on them. It's a very hard job. The same thing like doctors. Like we have a hard job, and not all doctors are created equal. And we all have different strengths and weaknesses and things we focus on, including the topic of ADHD. So one thing that you could do is to know how you can help your child at home and help translate that for the teacher. This is what I know when they feel overwhelmed, and this is what helps them. This is when they get stuck and they don't know how to solve the problem. This is what's helped them.
Okay.
So you practice at home, and then you can help to communicate with the teacher. These are the accommodations and the structures that can help support them. Now, where does the label potentially become helpful here? In general, a school is going to have more access to resources and accommodations if there's an official label there.
They can create the IEP, the individualized education plan, right?
Yeah.
That's correct.
Okay.
So this is where sometimes bringing it up to your healthcare provider can be a good thing, because if they truly have the diagnosis, if that label truly helps them, that's where it can get the proper supports at school.
That makes sense.
Because sometimes just using that label opens a door. Hey, my child is ADHD. They're going into this grade for school. I want to know how we can help support them. They hear ADHD and they think, oh, it's this category. We have these supports. We know how to help them.
It's a tool. It's really just a tool.
That's exactly right. Yes.
Yeah.
That's what I wanted to emphasize. Everything we're talking today, it's all language. Language is a tool. It's how we use it.
Yeah.
So that's what I would encourage parents. And also depending on the age, in general, under 6 years of age, they mainly encourage to do what's called parent behavior training. And basically what we're talking about, how do we identify what is keeping them stuck and how to respond as a parent. That's what it is. After age 6 and above, that's where plus or minus medication, if appropriate, and that's a discussion to have with the healthcare provider, but also teaching the how-related skills, helping them feel able in the moment, and just broad parenting at large to help motivate them to want to do it.
Can like a cognitive behavioral therapy help at all with ADHD, or is that not really what that's for?
So yes and no.
Okay.
What's interesting is that just in terms of a full treatment alone, cognitive behavior therapy may not help all areas, especially in the executive functioning realm for the how-related skills. So labels aside, we may have struggles in a lot of different areas. Cognitive behavior therapy can help to maybe untangle some of those thought processes that keep them stuck. So it can help in one area, but many times it won't help solve everything. So this is why I like to emphasize to parents and empower them, because there may be a lot of parents, and maybe you're feeling this, that my child is stuck, I'm having this struggle. Maybe it's a little bit, or maybe it's just full blown and it's exhausting. Regardless where you find yourself, it's tempting to think, I just need to find the right thing outside of my child. If I find the right therapist, if I find the right pediatrician, if I find the right medication, if I find the right tutoring program, if I find the right extracurricular, maybe that's what my child needs. And to be clear, any one of those things can be wonderful things. I sometimes prescribe medication when appropriate. I sometimes refer to therapy when appropriate. And I think there are other interventions like school, tutoring that can help. But one of the most powerful things you can do as a parent is understand what your teen is struggling with and know how to respond to them differently. And that is what changes everything. And interestingly, that's also what the literature shows as well. The parent-child communication patterns that are established during that period doesn't just help them now, it actually helps them into adulthood. So I like to say, if you change how you respond, you can change who they become.
Wow.
That's powerful.
Yeah, because the communication patterns you start having with your child, with your teen today, becomes the voice they carry with them tomorrow. And you want to start now by understanding them and responding to them in a way that actually helps them to feel understood and build skills. And in essence, as an adult, that's what you've realized.
Yeah.
So that's why this is helpful for humans in general, even though we're talking about ADHD. But this is why it's so powerful to understand and respond in a way that actually helps them and works with their brain.
I think that,
Wow.
and that was so powerful. And well, you talked about, changing who they are later because they've, been given the tools and the support at home to be the best version of themselves.
Yeah.
I'm thinking there's a lot of myths that surround ADHD.
Yeah.
You might think that, they're lazy or their parents weren't good parents and that's why they act out. And can you kind of address a few of those?
I'm glad you brought that up because yes, I think the first one you mentioned, they're lazy, they're unmotivated, they're defiant, they are having an attitude problem, they're having a behavior problem. Notice what we're doing here. All these words we're using, they're also labels as well.
Yeah.
So at the end of the day, as a parent, can you 100% know whether your child is intentionally defying you, being defiant, or they're truly stuck with a how and feel problem, or anywhere in between? Because to be clear, does character matter? Absolutely.
Yeah.
Does responsibility matter? Absolutely. But here's the thing. If we assume that, well, maybe they have ADHD, they're just lazy, they're unmotivated, is that actually helpful?
No.
Is that actually going to help them?
Right.
So what if we assume the opposite? What if we assume that they're actually stuck? They want to do well, they just don't know how, or they don't feel able to in that moment. You may be wrong, but guess what? Doesn't matter. That's how we can actually
Give them a
help
chance,
them.
yeah.
Exactly. So that's one of the biggest myths because in my experience, how, feel, and want, all these three can be barriers combined. But in general, a lot of times what I see is parents think, my child, my teen, they just don't want to do it. And it kind of makes sense when you look at it on the surface, like clean your room. Sometimes they do it, especially if they give reminder number 7, you're grounded, pressure. So it's confusing when sometimes they can do it and sometimes they cannot. And it's because all these three barriers, they're not static. They're dynamic. It may change from moment to moment, from day to day. One day, the how may not be as much of a big of a deal. The feel, they're okay with it. And so that's why they can actually get started and follow through on that day. But the other day, they're struggling with. And it's the same thing as adults.
Yeah.
We could want to show up to work or show up for our spouse or whatever it is. But some days, it just feels harder.
Yeah. Yeah.
Or some days we can't think as clearly and I don't know how to solve this problem, right? The barriers change from the moment. And the same thing is true for your child, for your teen. And so therefore, I'm glad you brought that up because that's why a lot of times with ADHD, it's not doing what they know, or excuse me, it's not knowing what to do. It's doing what they already know.
Okay.
That's what you hear as a parent to try to help them with.
So really the things that to look out for, it's about patterns, right? So you could have a child that maybe struggles to clean their room for whatever that reason may be. But if that's the only area where you're seeing that sort of behavior, it may not be an ADHD thing. It might be more of whatever, right? But if you see that you ask them to do other things and they're struggling, or maybe you're hearing about things at school, or maybe they're a teenager and they have a job and you hear about things there, or whatever it is, it's kind of right when you start to see these patterns developing, that's where it might be time to be like, let's go see a doctor and see if there's something more going on.
An impairment.
Yes.
Yeah.
I'm glad you used the word pattern because that's what I use actually intentionally, that word.
Okay.
When something repeats itself over and over. And it may not be as simple as what you would think, where the obvious impairment is they're struggling at school, all classes, struggling at home. That's the one that's a little bit easier to diagnose. There are some that after speaking with them, I think, you know what? I'm seeing you as a teenager. I think you may have ADHD and it just hasn't been diagnosed. We just haven't put the label on there like you as an adult.
Yeah.
But it helps to explain the patterns. It helps to explain the thought processes, how the brain works. And so I've seen some teenagers that are actually honor students doing phenomenal in school, but they still struggle with similar patterns that actually fit with ADHD. So impairment does not necessarily have to show up in what you think it could look like in all areas, but this teen was masking all throughout the day. Hard to get through that one. And by the end of the day, she's losing it, and home life is so tense. So that's exactly. So that's an example of if you walk through the how, feel, and want. It sounds like she wants to do well, but she has to expend all that extra energy in order to redirect her focus at school constantly, to redirect her emotions constantly, and then by the end of the day, it's like I'm spent.
Yeah.
Now the how and feel starts
can relate.
starts accumulating. Yes. So that's why it is good to look at a big picture. what are the patterns that are keeping my child, my teen, stuck? And that's how you can start to help them. You mentioned other myths. What are the other ones that you mentioned? You mentioned laziness. There was something else.
We talked about, bad parenting.
Oh, yes, that's right.
Or maybe that you will outgrow it eventually. That's something I've heard. Or and obviously this is not true, but sometimes people say it's only boys.
Oh, yeah.
So,
too.
Yes. So these are all very good ones. These are myths as well. So let's tackle them one by one. Bad parenting. Bad parenting does not directly cause ADHD. Now, having said that, there are a lot of different factors that can influence when one has ADHD. Mm-hmm. Genetics is one of those. It's not the only thing, but it's one thing. We also know development is very important. Mm-hmm. How is developing brain and body from the womb to birth, all the way up to young child, older child, teenager. So the developing brain, especially in the early ages, is very prone to being formed and shaped based on its environment. So therefore, that can help to either nurture or trigger some of the symptoms. Mm-hmm. And so it's really complex, and that's why we don't have a single test that we can do. But what you do as a parent can definitely influence how they are able to mature and grow if they have ADHD, but it does not directly cause it 100%. So therefore, you cannot say that, well, this child has ADHD because the parents are bad parents. Mm-hmm. So if you're a parent listening to this, I've even heard stories and seen where one sibling does not have ADHD, the other one truly does. Same household, same parent. Arguably, every child is having a different environment because the fact that you're having a second child or a third child changes the dynamic, but still, it's not your fault. And if you're hearing this and you're feeling exhausted or guilty, just know that I like to say this to the teens, but I like to say this to you as well. To the teens and the children, I like to say this. I'm here to meet you where you are, but we're not going to just leave you there.
Well, yeah.
So therefore, you're having empathy to understand, but understanding is not the same thing as excusing.
It's accountability, yeah.
Exactly. Mm-hmm. Explaining is there to understand, not to excuse behavior. So that's meeting you where you're at. We're not going to leave you there means we're going to provide the support, the structure to help you learn the skills, to help you know how your brain works, and for your parent to let you know how your child's brain works, so that way you know how to respond to them effectively and help them. So in the same way, as we're having this discussion, maybe you're feeling burdened or heavy, this is kind of hard. Maybe I'm not responding the best way. None of us are perfect parents. As my child grows up, I'm not going to be the perfect parent. Mm-hmm. I'm not the perfect parent right now. We're all constantly learning. So we're here to meet you where you are, but also hope this conversation doesn't leave you there, but leaves you empowered.
Yeah.
So that's one of the myths. The other one is outgrowing it. In a sense, you don't fully outgrow ADHD in a sense that you have the diagnosis and you don't have it. You had an ear infection and you don't. If ADHD is truly part of the brain wiring, you're still going to be wired the way you are, but there is some neuroplasticity, which is a very fancy word of you can sometimes change the way that your brain processes things. Executive function is a skill, and like any skill, you can learn.
Yeah.
Some skills come more naturally and easier than others in different children. And for some children, it's more natural to be outgoing. Mm-hmm. It's more natural to have a lot of energy. It's more natural to touch things and interact with things, and that's how they learn. It's more natural to be able to engage with others, introduce themselves. Maybe it's less natural for them to sit still in a classroom, read something, not fidget, raise hand to ask a question. School measures only one type of learning. Mm-hmm. It doesn't measure all types of learning, all types of skills. And so this is why, going back to one of the other myths, that ADHD is not about just behavior issues like laziness. It's also not a matter of intelligence.
Yeah.
That's another important thing. If you have ADHD, the label, that does not mean you're not intelligent. It just only explains the way your brain tends to be wired. And so therefore, this is very important to realize, because school only measures one type of skill, of intelligence, if you say. But when you think about it as an adult, how many jobs require a lot of the traits that a lot of people with that ADHD have?
I'm thinking hands-on, you have people that are, farmers that are outside, working, and then you have people that are very technical, maybe an engineer or a mechanic or a plumber or a welder or something like that. And then you have scientists and researchers and writers, and they're so different. And if we didn't have all of those, where would we be?
Exactly. So, and even within the job descriptions are all these not just one step, but 10 steps, 20
Yeah,
steps, all the
right.
different things that they do. And we have different strengths and weaknesses that we can all work on our weaknesses, but we also have clear strengths. And so that's why some people call ADHD as a hidden superpower. I don't always adopt that language.
Yeah.
I think it can be helpful in the right context, but I think in some situations, maybe it could be unintentionally overlooking the struggles that they truly have. And so I don't want to just dismiss and say, oh, it's a hidden superpower, because some people feel like, I don't feel like this is a superpower at all.
Yeah.
Or even the child. Like imagine this. There was a study done, I want to say the late 1990s or so, which is crazy. What is that, almost 30 years ago?
That's crazy.
My goodness, we're old. That they studied kids with ADHD. By the time they reach 5th grade, how many negative or corrective messages they've heard just from school by the time they reach 5th grade. I want you to guess. How many?
I
would
don't
you say?
even know.
Just put a number out there.
Like from kindergarten to 5th grade, or just
yes,
in
kindergarten
their
to
own
5th
time
grade.
life?
Yep.
I don't know, like 50?
I'm gonna say it's
100?
like hundreds, I would think.
20,000.
And you're talking about things like just little snide remarks and that sort of thing too.
Exactly.
right?
Now the number is going to be different for every child, but
Right.
just imagine this: 20,000 moments of you're not listening, you're not focusing, sit still, you can't control your emotions. Stop that. Stop fidgeting, stop moving, pay attention.
Okay.
Imagine over time what this potentially could do to you as a person, as a child, as a teen.
Oh,
Makes me sad.
even if it's unconscious. And I don't highlight this to be shaming, because maybe there's parents listening to this. They're thinking, oh my, that's me. I just share this to be empowering, because understanding is empowerment. And just know that the reason I'm so passionate about this is because this is more than just about cleaning the room.
Yeah.
This is more than just about making sure the homework gets done on time. The reason I'm passionate about helping strong families, empowering parents to understand and respond differently, is because a lot of kids, children, teens with ADHD, they truly feel misunderstood, whether they realize it or not. And many of them may take on a low self-esteem, a sense of shame. Like, why can't I be like my sibling who doesn't have ADHD? Why are the rules different for them? Why can't I just do this the way normal kids do things?
Yeah.
Why am I different? So whether they voice that or not, that's the underlying feeling. And so therefore, if they're constantly hearing that, that becomes potentially debilitating, especially for those who really, really struggle. And so therefore, many parents feel stuck because, well, do I acknowledge that? Like, how do I help them and how do I respond? But I also want them to do well. That's why you meet them where they are, but you're not going to leave them there.
Yeah.
And that's very important, because I think so many people make the mistake of the extremes. One extreme is to just meet them where they are, and that's it. Oh, I understand what's keeping you stuck. I understand why it's hard. You have ADHD. Oh, it's attention deficit hyperactivity disorder. I guess it's like a disability. Well, that explains why everything is stuck. And then they live in excuse. Remember, explaining is not the same thing as excusing. So that's leaning too hard on one. Empathizing, but not knowing how to empower them. The other is to totally ignore the label, totally ignore the struggles, and say, pick yourself by your bootstraps. You need to focus. You need to listen. You should be able to do it. And they're endlessly stuck and understood because they don't know how, or they don't feel able to. And if that repeats itself over and over and over, that's when they could lose motivation and say, you know what? I don't want to do this. Why would I want to do something that always ends in tension, frustration, and something that just doesn't make me feel good,
Yeah.
right? So we have to meet somewhere in the middle where we can empathize, but still hold expectations and provide a structure. I like to say we lead with safety, we provide structure, and we give them a say. We don't have time to break that down today, but lead with safety is empathizing where they're at, acknowledging their emotions, but you're not going to leave them there. That's when you provide structure, like we mentioned before. Keep it open when okay, keep it simple when stuck. That's a structure. Give them a say, gives them some autonomy, not just because you're being nice or because some kids like to be in control, because giving them a say practices that thinking part of the brain, practices executive function, making responsible decisions. So you're scaffolding it in a way that makes them feel understood, but you respond in a way that can actually help them go from stuck to unstuck.
Wow.
Wow. My brain is like, spit him like
Yeah.
a lot. There's just so
I mean,
much.
it was really powerful. And I mean, I feel like the points you've driven here don't just apply to parents of kids that have ADHD. I mean, it's very much supporting them because, I mean, anybody can get in that cycle occasionally. So the how, the feel, and the want, I wrote it down. And I mean, that's applicable to pretty much any child.
Oh, absolutely. And that's the beauty of this, because you could apply this to marriages. You could apply this to coworker relationships. There's a lot of places you could apply this to. The beauty is that, yes, it is especially helpful for ADHD, specifically of the ADHD related challenges in the how and the feel and the want. And so just a brief summary is, if you want to take the science and kind of just boil it down, it's more complex than that, but it's an oversimplification. In a sense, executive function, what is that? That's how. Emotional regulation, what is that? That's feel. Dopamine, that's just one area. That's want. Of course, human motivation is more complex than that, but dopamine can explain that. So in a sense, that's a very simplistic way for taking something that's complex and making it so that way a parent at 9:17 p.m. doesn't have to think through all the neuroscience to try to know how to help their child. They can think, oh yeah, is it a how, feel, or is it a want problem?
Yes.
It's a good place to start, and something that you can grab onto so you can know how to respond more effectively in that moment. And so yes, that's why I mentioned to start, labels don't define who you are. We're all human, right? It is what it is. We talk about ADHD kids, normal kids, neurotypical. We use these labels. We're all humans. We have different strengths and weaknesses. And for those who have the label of ADHD, this is where it helps them even more so.
Yeah.
But it applies to everybody.
Very good. Well, thank you.
Yeah, I've
This
learned
is,
so much.
I don't even know what to say, because
Yeah.
I've picked up so many bite-sized pieces, and I'm sure that everyone listening has as well.
I do have
is
one
incredible.
one last question.
Yes.
So for parents, or even, I mean, if there's a teenager, whoever might be listening, right? If they suspect that they or somebody they know may have ADHD, what is their next step?
So one step is education, and you want to find the right type of education. So make sure it's from someone who is either a professional that is giving you the correct information. There are resources like CHADD, CHADD, that's like children and adults with ADHD. They have good articles. Another one is Attitude magazine, ADD, Etude. That's another one.
Nice and clever.
So those are resources. There are some good other articles, videos. You just have to make sure you find somebody that is trustworthy with the
Okay.
right information. So that's one to get understanding. Another one is finding a good healthcare provider if you're really struggling with home, school, or both. Because once again, getting the diagnosis can be helpful in the right circumstance. And so therefore, think of it like a partnership, because when you're going to your healthcare provider, I like to empower parents with a good question, because especially when you're going as a parent to any specialty, whether it's a pediatrician, whether it's a specialist, obviously there's this feeling of this mismatch, like, well, I'm not medical or may not be medical, and they're up over here. But this is where a very good targeted question can help. For example, here's one good question. You could go to your healthcare provider and just ask this: hey, I'm concerned that my child may have ADHD. What is your process for evaluating to see if they have ADHD, and how can this potentially help them?
Yeah.
Yeah.
It's an open-ended question. And so therefore, you just hear what they have to say. If they give you a process, they may give you their specific answer. Different clinicians will do it different ways. And that's why it's a clinical diagnosis. And you ultimately want to know what's the process, because you want to understand, and how will this help them, because what's the response? Whether that's medication, therapy, school accommodations, helping you as a parent.
Yeah.
That's what it's about. So come in with that attitude of knowing, how can I get more understanding, and what are the next steps afterwards? So that question alone, my child potentially has ADHD, I'm concerned. What is your process for evaluating ADHD, and how would that potentially help them? That's a good question.
You can even ask that question as an adult yourself to your
Yeah.
primary care provider, whoever it may be. So
Yes, absolutely.
Dr. Michael, are you accepting new patients?
Yes,
Okay,
we are.
good.
So yeah, I do see children of all ages, from birth all the way to around 17 to 18. The older ones are usually the ones that I've seen for a while.
Yeah.
But if you're 18, sadly, sorry, we'll go to the
primary
older
care,
older
Find
doctors.
older doctors.
Yes.
Yeah.
Yes, but this is something that I also do routinely as well. A lot of things I've talked about here, I do try to share in the exam room as well. Obviously, we've spent almost 45 minutes talking about this. I'm glad we're doing this. It's because I don't always have the capacity or the time to spend all the time that's needed with families. So it's good to have a reference like this that I could say, if you want to learn more, here, listen to this. Absolutely, because that's why I say it's a partnership. Sometimes I just have to meet the parents where they're at, try to help them one step at a time, do what we can. And that's my approach.
That's wonderful. Thank you again, Dr. Tjahjadi, for being here. So Dr. Tjahjadi often goes by Dr. Michael to your patients. His office is located in Statesville near Iredell Memorial Hospital. IredellPediatrics.com is the website. So look him up, and thank you again.
Yeah. And if you like this episode, make sure you like, share, and subscribe, and we'll see you on the next episode of Inspire Iredell. Bye, guys.
The content here is for informational and educational purposes only, not for medical advice. Consult your qualified healthcare professional for specific health concerns and questions.